Good morning, everyone, and you're very welcome to this afternoon's HSE webinar and staying connected in these times. Just before I hand you over to your host for today, a little bit of housekeeping to do. Um, I'd like you to use the Q&A feature at the bottom of your screen to ask questions throughout the event. There'll be plenty of time for live Q&A, so please get your questions in for Dr. Eddie Murphy and the panel. And the raise hand and the disable chat, or the chat will be disabled this afternoon. Also, just to mention that we have Catherine White joining us as the sign language interpreter, so she will be on screen at all times. Without further ado, I'm going to hand you over to your host, Sarah McCormack.
Good afternoon, and can I say a Céad Mila Fáilte Ribh go léir, and you are all very welcome. And I want to say thank you very much for giving us your time to come and join this webinar this afternoon. And I know as you come here and join us, that you're coming here with the expectation of hearing and getting some good ideas and tips about how to improve your well-being and how about actually staying connected in these times. And I assure you that's the objective of this webinar. My name is Sarah McCormack. I'm the National Lead for Healthy Ireland in the HSE, and I'm also the National Lead for Staff Health and Wellbeing in the HSE. And when I mention staff health and wellbeing, it is absolutely key to me, and I'm passionate about it because I believe to provide compassionate and safe and high quality care, we must take care and look after ourselves and our teams. So just think about it. We need to actually put staff health and wellbeing right to the fore and have it as paramount. Because if we don't look after ourselves, well, really, it's quite difficult and challenging for us to look after others. And an analogy that I actually love when I'm actually thinking about that is thinking about our mobile phone and the battery and the running down of the battery. What happens? We get a red light, we run for the charger, we plug it in, and zump, up comes the phone and it's alive again. And I love to think of that charging as the well-being assets that can actually lift our life and improve our mental health and well-being. Well, think about it. What's the red light that triggers for me? What's the red light that triggers for you? How do we know the battery? And what resources are we actually taking to build ourselves and build our resilience in there into it? The last webinar that we had was on the 21st of October. And in that webinar, we talked about keeping well when working from home. And following that webinar, we got wonderful feedback from the survey that we sent out. And we had over 700 on that webinar. Now, we took the feedback from all of you and really appreciated it because we actually put together today's program based on that feedback. And that is where we actually have come up with the topic of today. As we can see, time is passing on. We are now on the countdown to Christmas. As they say, nothing stops time, not even COVID stops time for us here. And as we talk about Christmas, I actually think about that wonderful resource that we have here through HSE Health and Wellbeing, our countdown calendar to Christmas. So Leo, let's share the countdown calendar to Christmas here. And I know that many of you have received it, but I assure you it will be in the pack going out after today's webinar to you and circulated to everyone. And in that calendar, there are loads of tips there about actually helping ourselves to stay positive as we actually come to the countdown to Christmas. And we know we talk about the Christmas being different, but being different can also be good as well. And just as I sit here today, I suppose there's two things I'm going to look at. Please note the 16th of December on the calendar, because on the 16th of December, we are going to have a wonderful staff and health and wellbeing webinar, which is going to be all your music, your singing, in putting that together with an uplift, which will be doing a piece for us in replacing what we used to have, our face-to-face choirs at Christmas. So don't forget the 16th of December. Today, we're on day 2 of the countdown. So what's the message there and what's the hint for us in relation to day 2? And day 2 is actually telling us about minding your well-being and the Minding Your Well-being program. Now that's a program that we launched here, HSC Health and Wellbeing, quite recently. And it's a program that I'm going to encourage all of you to go on the HSC website there and actually look at the videos that are there, because they are full of richness and full of great tips and great guidance for us in relation to keeping ourselves positive and building that positive outlook for our lives. I'm just noticing here, and it's flashing up on my screen, is that we're getting a wonderful attendance here this morning for this webinar. So I guess that what I can say is that everybody can, from a salesperson, what did they say? Make every contact count. So I'm going to use this opportunity to actually get a little bit of feedback from yourself. So we'll actually look here at a question and just pose a question out to see what way that you're thinking right now from all of you that has joined the webinar. So to the backroom team, let's just put this question up there for us. And we're asking you, how has COVID impacted your sense of connection with others? Not at all, somewhat, or a lot. So you can just press the button there and you can actually vote and give us the feedback. Now I'll let the backroom team compile all the answers and we'll come back there and we'll actually see what are the results and what's the feedback coming from yourselves. And as I'm looking at that and taking the feedback from yourselves, it comes to my mind here about the results that we actually saw from the Central Statistics Office survey that they carried out there in November. And they actually were looking at the social impact of COVID on people's lives. Now, the results of that survey, you heard it there, it greatly impacted government's decision about the level 5 and the level 3 and the come down to Christmas. And there's two pieces in those survey results that really resonate with me. And the first one is that 13.7% of the people there reported that they were feeling lonely and loneliness. And that compared with 6.8% in April. The other one, 11.5% reported being downhearted, feeling depressed, and that compared with 6.5% in April. So you can see across the months, and even bearing in mind that that was during the summer period, and the days were bright, and the times were good, we all had the opportunity to be out there. So I think and it's well in fitting that we're here today, and we're actually looking about in that topic of staying connected with the recognition of all of that information. And I'm delighted to bring to you two people who have got a vast experience and vast knowledge in all of those areas, and is going to share with us some of that knowledge and give us some tips here today. So I will first of all introduce Anne Sheridan, Anne, my own colleague here in Health and Wellbeing in the HSC, and Anne is our Programme Manager for Mental Health and Wellbeing. Anne, you are very welcome and thank you for joining us.
Thank you, Sarah.
I also welcome Dr. Eddie Murphy, a man who I don't think needs any introduction at all, but a principal psychologist, of which we are also very lucky to have here in the HSC. So Eddie, you're very welcome, Eddie, in joining us here today. So I feel wonderful, I feel energized and great to be surrounded here by two people, which has got such a great knowledge in here. And Eddie and Anne, you hear a lot, and you saw a topic there about staying connected, and there's a lot about connection and connectivity and connecting with nature, connecting with each other. So I'm interested in digging into your brains now and just seeing what does that actually mean to yourselves. So Eddie, as a well-known guest here, I'm just going to put the spotlight onto yourself here and just give us some of your sharing.
Thanks very much. Really appreciate the opportunity to talk to so many staff members, and I believe there's some guests as well from outside the HSC. And my background is a clinical psychologist, and I work in the HSC, have been for the last 20 years. I'm very proud of the area I work, very proud of my co-workers. And today it's this whole area of connection. Connection to me is not about an exchange of information. Connection is that human experience of connecting with somebody, with your emotion, with your head, heart, and guts, as it were, in terms of, and that's why I want really to, even through this virtual reality, I'd like to know of this virtual world process that I'd like people to walk away with. And I think in our conversations today, our goal is to enhance people's connections, either with themselves, with their colleagues, and with others. And so it's a great opportunity. It's great to link with health and well-being and Sarah, and really forward with Anne as well, who's a wealth of knowledge in this area. So, but my sense is that it's about relationships. Connection is about relationships, and relationships starts with ourselves. Starts with the relationship we have with ourselves, and I'll talk a little bit about that, I hope, later on, particularly around the area of compassion, how we can have more compassionate relationships with ourselves. And then, because even from the therapy room, you often see that person who is highly critical, punitive, propels themselves in a way that they're, you know, not good enough, not doing enough. And I'm saying it's okay to be good enough. It's okay, and using a compassionate voice. And then how we connect with others, and particularly in the area of this pandemic, a lot more people are engaged in remote working, and we have to look at that's created a sort of a dynamic in itself, and I'm sure that will come up in our conversation. I'll hand it over to Anne there, give a sense of what I'll be looking forward to listening to Anne's response.
Yeah, thanks, Eddie, and good afternoon, everybody. It's lovely to be here with you. So I suppose my interest in all of this is wearing my hat as program manager for mental health and well-being, and realizing that, you know, connectedness and being connected is so vitally important in terms of our mental health and well-being. I agree with you, Eddie, that it's a very basic kind of primal kind of human need that we all have, just to be close and to be connected and to feel close to other people. And to me, you know, it's as simple as that. So if I was thinking of one word that kind of, you know, is what connectedness means, it's about relationships, exactly as you said. And I think sometimes we can kind of take relationships a wee bit for granted and not realize the vital role they play. You know, the idea that, you know, to say that other people matter in our lives, or that other people in our lives matter, can seem really simplistic, but like that's really where it's at. That's where the magic happens, isn't it, in relationships? And it's not to say that all relationships have to be the same or have the same intensity, because one of the things that I'm struck by now that I'm working from home is I am missing the variety of relationships that I've had when I was in the office. You know, the people you meet on the corridor every day, the same people you see in the morning coming in and having a hello to and a chat with, to the people that, you know, I'd share coffee with, to the team members that I'd work with, to the colleagues that I'm closer to, that I might confide in or whatever. But I'm kind of missing that variety. And so I think that's another element that's important in thinking about connectedness, that we think about the variety of relationships that we have and that are important in our lives. I don't know what you'd say about that.
I think that's a very interesting point around variety, and but also I think the fact that there's been a massive change, right, for many people, and for other healthcare workers, is one of the things around. There's a buffer. Relationships offer a buffer, a stress management piece in terms of, and one of the things that really struck out, or particularly around that CSO data, was the impact of loneliness, the impact of how loneliness, and if you think about loneliness and connection in the talk that we're doing, just as we're thirsty, it's our signal to drink, and just as we are hungry, is our signal to eat. Loneliness is our human signal for human connection. I know that I was before COVID came, I was on the National Loneliness Task Force, and had a particular interest in this, because one of the things we identified is that loneliness impacts not just like older people in the west of Ireland, whatever, you know, you have a sort of stereotypical view. It impacts on new moms, it impacts on students, it impacts on people who come in. So and one of the things now we know that people in organizations that are maybe more in a remote working environment, there's increasing in isolation and loneliness, and there's an increasing need for us as if team leaders or whatever to how to reach out and connect with others as well. So there's lots of great conversation we're going to have today around this.
I think as well, I mean, if to flip that around then, so there are the consequences of kind of, you know, being more isolated, but the positive benefits then of, you know, being in relationships. Like relationships really, as you said, they're a buffer for stress, but they're also very protective overall for our health and well-being. And for mental health and well-being. Like, for instance, we know there is science behind this, that we know that that, you know, the more relationships that you are in, the better chance are that you'll have lower cholesterol, lower levels of anxiety and depression, higher levels of self-esteem, higher levels of immunity, which is really interesting considering that we're all trying to battle against, you know, a pandemic. And so I just think the benefits of really working and trying to enhance the relationships and value the relationships in our lives are really important. There's a guy called Matthew Lieberman. He's a neuroscientist, and he says that social connection is a superpower. That's the value he puts, because it makes people happier and more productive and healthier all around in their lives. But one thing I wanted to share with people is a proverb I heard.
Just around it, and just one piece to that, I think it's worth maybe highlighting as well, that because not everybody, because some people might feel that they're not have same wealth of social relationships, and it might create an anxiety for them. But there are some individuals who are more introverted, wouldn't have as wide a circle, and it's okay too. That's all right too, because there's different strokes for different folks. When you know, that I think it's important to highlight that as well. That if you're, some people have levels of, one of the most missed of actually all the anxiety presentations is social anxiety. And so it's just to get a sense that sometimes it's hard for some people to make that step into relationship, into that step into connection. And that's we understand that can be a struggle for people. And there's some great resources out there around that. For social anxiety, there's a great website called Social Anxiety Ireland. And I told you there'd be loads of practical tools here today. And for those that are introverted, comfortable in their own skin, they don't necessarily need a lot of that connection. And for some people, that relationship can be with animals, it can be with nature, it can be it can be with different connections, as it were.
Yeah, no, I think you're right. I think it's not about quantity; it's about quality, isn't it? And it's about having, you know, that one or two people. Like there's a question that we can ask ourselves that will, you know, and the question is, right, is there somebody at 3 o'clock in the morning that we could call up to tell our troubles to? And I think hopefully, as for everybody who's listening in, if you're thinking about this, that you can identify even more than one person. But the thing to acknowledge and to value is that that's really important in terms of your own well-being, that to know that there is somebody there that you could call on, that you have that kind of relationship with. But yeah, I agree with you, Eddie. It's not about, there's some people who like to have, you know, lots and lots and lots of people around them or whatever, but it's not for everybody, but it's about the quality of relationships. The proverb I wanted to share with you is, it's a Swedish proverb, and I just came across it recently and I thought it was really good. And it's, a shared joy is a double joy, shared sorrow is half a sorrow. And I love that, because I think it really kind of captures that kind of quality thing and just how important relationships are in the good times and in the bad times. And that they really add incredible, you know, value in both areas.
That's a lovely sentiment.
And I think that
I like that.
Isn't it, Eddie? Isn't it just fantastic? I'm writing it down here, and I'll certainly be taking that on board. And I think on that, it's a nice time, and I'll check in there with the backroom team for our poll. The question that we put up there: do we actually have the results compiled now, and what are our audience telling us here today? Okay. So the question being there, how has COVID impacted your sense of connections with others? So we can see
that's
there,
huge, 61%. Absolutely huge.
A lot.
Yeah. So that's, I mean, that's so big. That's showing that 99%. That's so big that it's showing that 99% it's impacted on. Like, it just shows you, like, that's a massive. You have an audience there of 400 people. So effectively 389 people have been impacted. That just shows you that how COVID is impacted, and probably shows you too. I think it's important to reflect as well. See, when we think about one of the areas I work in is the psychosocial response around COVID situation. I'm the lead here in CHO8 and Mead Loud, Lee Shoffley, Longford, Westmead. And when we think about this a lot, is that the impact of COVID is quite often about the sort of a one-off, like a pebble going into a pool and the ripple effect. But actually, we need to think about this COVID because it's a prolonged experience. It's not just one pebble. It's this pebble going in continuously, creating a ripple impact. And that means our response needs to be thought about in a different way, because it's the prolonged impact of this. And what's reflected in that survey shows the prolonged impact as well. I think it's really insightful.
Yeah, because
and
I think
Eddie, I think on okay, sorry, go ahead, Anne. Yeah.
No. I was just going to say, because I think like there's the two things that we have to balance at the moment. We have to balance the need to be socially distant, and to have the everyday language of quarantine, self-isolation, all that that entails, and at the same time balance really trying to work on building connections and enhancing the connections that we have in our lives. So there's, that's quite a balance, I think, for people to do. But the other thing I think that's important, Eddie, it is a paradox, but I think the other thing is we need to normalize exactly what that poll says, that it's completely normal that people would experience, changes in their social connections in terms of what's happened, isn't it?
Yeah, I think that's a really good point, like because it's the human response. So fundamentally, this is about change. Like, we don't like change. We like to plow the same furrow. We like to, if you think about it, we're really creatures of routine and ritual, but this has created a massive change in our life, and change creates stress. Now, if you orientate yourself towards uncertainty and worry, that will increase your levels of anxiety and worry. If you orientate yourself towards change as normal, and I suppose the really important part here is hope as well. Hope is critically important. The vaccine program now is generated. We're here. We know there's still more to do. We know we have to keep a focus on where we're at, but also we know there's an out as well. And I think that's really important too. But it is a normal response to such an extraordinary time.
Yeah. And whilst it is a normal response, sorry, Sarah.
Yeah, I was just going to come in there because we talked a lot there about, connection and connectivity. But I'm interested in relation to, like, when we lose that, connectivity within ourselves and our social connection, what's that impact?
Well, that goes into the whole area. I'll just jump in very quickly to loneliness and isolation, and as I was speaking about earlier on. But here's the thing about loneliness, because loneliness is the equivalent to smoking 15 cigarettes a day. That's what they reckon, right? That's the impact of loneliness. Imagine that, because it impacts on our longevity, higher levels of depression, higher levels of cancer, higher levels of heart disease, and because it creates a stress response within the individual. So I suppose the big shout out here is that if you're in that space, then, and there's a mindset too that comes with loneliness. There's a mindset that it's a negative cognitive mindset that often goes with, people aren't interested in me, so I'm not going to be interested in others. It becomes a self-defeating sort of cycle, as it were. And so we ask others to reach out, but we're also asking that person who's experiencing loneliness to reach out as well. And what's your thoughts on that?
Yeah, no, that is really one of the points I was going to make. Well, first of all, just to say, yeah, exactly what you said, that look, when our social connections suffer, our overall well-being suffers, right? So let's just call that. So both, one flows from the other. So as you say, we're more vulnerable to stress, to feeling lonely, harder to be optimistic, our sleep will be affected, and just harder to have the willpower that we need to do the things that are good to do, like to go out and take a walk, to eat healthily and all the rest. So all of that suffers. So really it is important to try to build that. But back to the point you're making there about reaching out to others, I just think that right now is really important, that we have a thing, and particularly now coming up to Christmas time, I think as well, just to think about even our colleagues, like who do we know, and who have we noticed maybe that we haven't been in touch with for a while at work, and maybe to make that reach out to a colleague, because we know that everybody's experiencing this. And so just to do that reach out. And I think outside of work, if you've ever had the experience, as I had on Sunday, of calling a friend that I hadn't been in touch with for a while. And, often there's the temptation to say, well, you know what, I rang last time, it's her turn to ring this time. But I picked up the phone and I phoned her. And I was so glad I did, because I discovered that the reason she hadn't been in touch is because she'd been in really bad form and she'd had some health issues and stuff like this. And, you know, the minute you make that call, you feel so much better in yourself. The connection is restored. And, you know, and all it takes is making that phone call. But sometimes, you know I've put them off at times and said, you know, oh, I'll get around to that later. But somehow or other now, we need to plan those things a little bit more. And maybe, you know, if there's somebody that either at work or in your personal life that you're kind of out of touch with, just set yourself a goal and a plan to say, I'm going to contact that person. I'm going to do it, and when you're going to do it. And you will not regret it. And I think any of us who've experienced that would know that there's a win-win there.
Mm. And I suppose, Anne, as you're saying that, I'm just smiling to myself because I have a list down on my kitchen table of all the people that to ring, and I mark them off. But I'm actually saying I hope that my name is sitting on many kitchen tables in the houses, and that they're all ringing me as well into it.
Yeah, yeah.
And interesting, Anne, we're actually getting here is about, we want you to repeat the quote that you gave there about the giving, the sharing of a joy and the double joy. So Anne, you say it so well there.
Okay, so it's a Swedish proverb. Shared joy is a double joy. Shared sorrow is half a sorrow.
Okay.
So it's really lovely. And I could, particularly at a time when, you know, there are a lot of worries around. So it's just a real kind of reminder again, isn't it, of just how we can help to kind of manage and reduce some of those worries that we have.
Yeah.
Beautiful.
So Anne, yeah, and the audience is definitely resonating with it there. What I also want to share with you, Anne and Eddie, is that when we put out the call for the registration for this webinar, we actually added in a question, and we asked our people as the register, you know, to give us the feedback on that question. Now, as well as that, we enticed them because we said that we would have a raffle and we would actually have prizes. So we actually have the raffle done. We do have the prizes, and I will announce them at the end of the session. But like Eddie and Anne, I'd like to share with you now the results, the feedback that came onto this. And let's just talk about this because this is real live feedback for us. So we can see that on the graph. Like we asked the question, you can see it there, is please tell us one thing you are doing to help you stay connected with your work colleagues throughout this pandemic. So look at the green box there, the phone calls is really high there to 25%. The virtual calls is at 13%. So that's taken 38% straight off. Virtual meetings in there in the 20%. And the other one I have to mention is the WhatsApp, because I hear more and more open about the WhatsApp groups, and we actually are being asked more times about, will you join a WhatsApp group or whatever. Now, I know this is all great positive on what people are doing, but there was interesting feedback in this that came as well to us, was about actually the people that didn't feel that they were actually being able to stay connected. You know, and one of the, sometimes that this actually came out in the feedback was saying, I am still working as normal in the hospital, but it's friends and family I'm not connected with. Look, and the others fed back and said, yeah, I'm not connected enough. Not connected really, because I'm really depending on email in relation to connecting. And I'm so busy here that I just actually haven't even time. It's one webinar after another, and I actually don't know how to make this connection, but I'm hoping that I get good direction from here into it. So I suppose I'm going to come back and build on your expertise about maybe a call for action. How do we actually help the people? It's fine talking about the connections. How do we help us when we're not so good at making that connection? And some maybe thoughts that we might have on that. Okay, Eddie and Anne, whichever of you would like to grab it first.
You want to shoot, Eddie? Do you
ladies
want to go?
First.
Ladies first, right?
You go, Anne, ladies first.
Okay, I mean, what I think is very interesting from that poll, Sarah, is first of all, that there's a lot of connecting going on, and that's great. It's interesting that the phone calls, and I'm really delighted to see that they trump the virtual kind of options, because I think there's just something a bit more human about the phone call and more personal about the phone call than maybe the other methods that are used. But I think the other thing that's very interesting is that the face-to-face only happens at the walk-in, which is only 5%. And I think, that's a huge change, really, isn't it, from our normal working and the opportunity to meet people face-to-face. So I think that's sad, actually. That makes me feel a bit sad, to think that, right, we're you know, it's like very, and it's great that there are all those digital opportunities and all the rest. That is fantastic, but it's just, I think it's yeah, it's sad that the face-to-face has had to take such a step back. So where do we start? Like, how can people kind of really improve things? I think Eddie mentioned this at the very start, and I'm sure we'll come back to it again. You have to start with yourself. You need to be a good friend to yourself, and you know, I think the more that you can show compassion to yourself, particularly because, as we said, look, it's very normal to be struggling a bit at the moment. And so just give yourself the kind of level of compassion you'd give to somebody else. I think we're always nearly always more forgiving.
Sorry, Eddie? I thought you were finished. Sorry.
Yes, Eddie.
No, go on. Come on in.
Okay. So I just wanted to Q's and A's there, so please get them into us. And there was one person there who's identified a question around stress and caring for others, for family, self, and others. And in this caring space, this whole area of how we care for ourselves is particularly important. Just often people are around stress and burnout. I think it's come up in one of the questions. And around stress is like when your house is on fire. Okay, and you're trying to put stuff out, you're doing different things. Burnout is your house is actually burnt down and you feel exhausted. So if you're in this stress phase, we don't want you obviously to get into a burnout phase. So this whole area of connecting with others and using self-care as your first tool when it comes to supporting yourself. I think it's critically important as carers, because healthcare workers really, we know now, our capacity is shortened. Our capacity, our tolerance is reduced. A lot of people are feeling very fatigued and exhausted. And in the context of that, I suppose it's a big shout out around self-care. That's really the key message I want to get out today, that because you're worth it, first of all, it's for you, the individual, a person who has that space. And that's just, you know, it's a struggle for everybody. There's no expert that has suddenly got all this. If you're struggling with your family, your children, in my context, I talk about it openly, like in our family, I have 2 boys, 10 and 12. My wife is recovering from cancer, the level of vulnerability in our household and stuff like that. And, you know, believe me, there's no expert. It's everybody just trying their human best to do these things. So, but putting a little bit of front and center your own self-care, I think, is really important.
Yeah, I agree with you, Eddie. I think that's where it starts. And you know the phrase, we're all in this together, and we really are all in this together. And I'll just share with you that back in August, I found myself a bit under the weather with everything that was happening. It was just, I don't know, I described it as kind of being under a bit of a COVID cloud for a few weeks. My sleep was affected and I felt a bit anxious, and I just felt, I just wasn't getting, it was a struggle to go out and walk, which I do every day. So these things, I just really found that difficult. But so one day I was having a coffee with a friend, and I told her how I was feeling and all the rest. And she said to me, "Lady, you need to up your self-care." Now, I know all this, but here I was, really not putting it into practice. And it took a friendship and it took a connection with somebody to kind of remind me of the importance of doing that. And once then I thought, right, you know what, dead right, I just need to, do put some things into practice around my own self-care, and that got me back on the road again. So again, I think I'm just reinforcing that you start with yourself, but sometimes it's the acknowledgement is important, that you have to acknowledge to yourself, first of all, that, you know what, I'm struggling a wee bit here, and then you got to do something about it. But one of the good things, really positive things to do, is just have a chat with somebody about it, because remember that in itself will help. I just wanted, before I hand over, Ed, can I mention Mind Your Wellbeing, if you don't mind? Because Sarah, yes, you did mention that at the outset. And Leo, I might get you to put up just the first slide there, which is just to remind everybody about this program, because this is something positive you can do for yourselves. Mind Your Wellbeing is a series of 5 short videos, so it's not going to take a long time to watch any of them. And the other slide maybe, which, yeah, that's it. So you can see there just what minding your well-being, the videos. So there's a video session on practicing self-care. So there you get the practical examples of that, understanding your thoughts and so on. And each video lasts about 20 minutes. I'd advise you not to watch them all at the same time, maybe space it out a wee bit, but each one has a challenge and an idea and a practical tip and a strategy that you might employ that combined will really help to mind your well-being. And just the second slide, maybe, Leo, there is a session there on building positive relationships, as you can see. So that really centers relationships, the importance of relationships in terms of minding your well-being. Have you got the other slide, Leo? Doesn't matter.
Sorry, Anne, no, that's the second one there.
No, put up the first one then again, maybe.
Oh, yeah,
you don't mind.
sure.
Yeah, so it's just the wrong way around. That's it. So this is the central piece in the session, in the video, that's looking at positive relationships. And Professor Martin Seligman, who's kind of world expert in positive psychology, the most important contributor to positive mental health and well-being is to have good relationships. So the whole session looks at, you know, some practical ideas and thoughts about how you can actually kind of mind your relationships. But the series looks at a list of different strategies, one of which is practicing gratitude. And that's a really important one in terms of building connections as well, because if you could put into practice every day or every evening as you're going to bed at night, just to write down the 3 things that you're grateful for in your life, that very often you're going to be referring to relationships that you're grateful for in your life, or thinking about relationships. And just even doing that practice is going to help you to be more mindful and just more tuned in and taking stock of the important relationships in your life.
Okay, Eddie, did you want to come in there? I know we butted across there with you, with Anne was going to talk about well-being. So before I go over to more questions from the audience, did you want to come in there, Eddie?
I just think that I just want to reinforce the work of Martin Seligman and the opportunity it takes, because what we're really saying is that it impacts on our mental well-being. And what's really I find interesting is, for years we've talked about mental well-being is about the absence of like depression or anxiety. But actually we've only started looking in the last 30 years of what keeps well people well. And this is what Martin Seligman has done and given us really good science background. What keeps well people well? A life of pleasure, meaning and engagement. If you could imagine now, I know it's a winter's day, but imagine if I could offer a nice hot chocolate, maybe with a little bit of brandy in it there for you. It's a little bit well-being moment, okay? Normally you do this with an ice cream in the middle of summer, but I was trying to do something. And I give you, but how many of those pleasure moments, like if I eat ice cream and would you have a second ice cream? The pleasure is short lasting. But here's the deal, meaning and engagement. And if you have meaning and engagement in your life, to me, that's the dynamo to your well-being. And putting emphasis onto that meaning and engagement. And quite often that's around families and friends. And again, I know one of the questions coming through is about doing things for others. But sometimes we have to maybe not do the things for others, and we empower others to do things for themselves, so that and sometimes that's about being assertive and learning some skills like that. So having meaning and engagement is something that I wish for you all today.
Okay, and if it's okay, Anne, I was going to come in there because I see a question coming up there, which I think is really, it's really key. It's about, the best way to support a colleague who tested positive, return to work, and the colleague has feelings of guilt because the unit closed in relation to the COVID. So something very real and very practical that's happening out there. Eddie, would you like to?
There's a couple of things around that. I've seen this a little bit. It's complex, right? Because first of all, the colleague the individual themselves may feel guilty. The team might feel angry. We don't know the impact of, even though that person was positive, you don't know actually for a fact that person brought COVID into the unit, because there's a lot of, even though the whole place might have been tested and stuff like that, it could have been an asymptomatic carrier going through it. So I think it's really important, like around maybe some work around the individual. I'm not sure the question is about the individual or if the question's around the team, but I think there are going to be there's a need for some facilitated team discussions around this, because there could be some complex communications associated with this.
Okay, another question that I see there is, I work in a hospital and work has dominated my life since COVID hit. I feel I've lost connection with my family, and as all my energy goes to work. How do I reconnect with them? Nice question.
Yeah, I think that's, I think that probably is an experience that a lot of people have experienced over and still are experiencing over the time, because there's just, I think work, particularly on the front line, has taken so much from people at the moment. I think one of the things to do is just to start small and don't expect, you know, to do too much, but just to think about, look, a moment, whether it's one dinner a week or something like that, but some time that you can spend with family, and kind of try to build that into your routine in a way that works for you, considering the work schedule that you have and all the rest. So just to try and build something like that, some kind of regular routine that has you spending some time with your family. But again, not beating yourself up about the fact that this has been hard.
For this person, I would say that it sounds like a level of tiredness and exhaustion as well, right? That's what I hear. And I sort of what I hear too is that you've given so much time into the work environment, and what you're saying is you haven't given into the family environment. But I'd nearly caution you now, because I'd say to you, awareness is really important thing, and this is what you're showing here, is really awareness, because it creates a first really good step. But if you're going to give it to one, as in the hospital, and now you're going to give it to the next group as your family, I'd say start with yourself a little bit, because it's been a very challenging time, and I think that it's okay to express, even to acknowledge. Acknowledgement is really important, and even acknowledging the family. But I do think that I really would encourage you to take a little bit of time in there for yourself as well, because I just think to replenish and to re-nourish. And sometimes when you're so much at the cold face, you mightn't even realize how tired and how exhausted you are. So a little bit of time for yourself as well as to others.
I think, and I see another, which is great, we're getting the comments and the questions in. I think this is a really nice statement in a way. In normal everyday life, some people have many connections with people. Maybe our circles are too big. COVID has enabled people to be focused more on the people who really matter in our lives. Oneself, as you're saying there, Eddie and Anne, families and close friends. So, you know, sometimes people talk about all the disadvantages to COVID, but we're also hearing about advantages of COVID as well.
Yeah, I think there's been an opportunity to take stock.
Yeah, there's been a massive upside, because a lot of people are reflecting about what's important in life. You know, what taking stock, as Anne said, is like, it's an opportunity to refocus. And that's for some, for many actually. People are thinking about early retirement, reduced working hours. Maybe it's going to be a challenge for the HSE around employment, to have more flexible employment, because people maybe want more flexibility in their employment. And that's more challenges. Some people maybe in certain grades might get that, and others can't necessarily get that. And so it's going to create opportunities and challenges for many different people.
I think if you go back to the first lockdown, if you go back to the kind of March and April time, I think people really launched themselves into that really, really well, and really worked really hard at kind of, when people were at home, children were at home, and worked really hard to kind of make that work. And for many, as you say, Eddie, it worked really, really well, and people got opportunities to be together in a way that they wouldn't have had before. I think it feels a bit different now. The wear and tear, I think, is there now, and it just feels different this time around. We're into winter, as you said at the start, Sarah. It feels different, and so I think all the more reason that we need to really focus on self-care and looking after ourselves, and finding some ways to escape. As somebody said, in an article in one of the papers a couple of weeks ago, there was a lovely phrase of go where COVID isn't. Go to places where COVID isn't. And they're the places where you lose yourself, right? Whether it is in a book, in a song, or listening to music, or, you know, whatever it is for you, but go where COVID isn't. And that's a really, so maybe over Christmas now, if we all could find places where COVID isn't, they're good places to go.
Oh, that's wonderful, Anna. Really like that. Now, there's a question coming in here, and I want to raise it because I think that, you know, we're talking about relationships, and when relationships are positive and all is going well, but, you know, we can actually have the struggle of relationships. So here's one that makes us think. Any tips for coping with working with people that you might not necessarily get on with and are now stuck in the one office with them? For example, they have annoying habitual habits that are annoying everybody, but none is addressing it, any advice. And maybe we feel because we're more confined in that, because maybe before this we might have been going out and traveling to meetings and been out from there. We're very much more confined now. So I think it's a point there is that we're with people that are annoying us. How do we actually cope with that? So a challenge of everyday life.
So toxic people, as it were, maybe people's mannerisms might necessarily could be more frustrating and annoying, but in the context of toxic people, I'm always minded of a client I saw who said, Eddie, I love my mum, but I don't like her. Okay. And we develop a strategy around reducing the toxicity of that individual. So it's I think it's quite a difference in people in your life that are toxic, energy drainers, as it were, versus somebody that may have frustrating habits. Like, for example, with that, it could be an environmental change in the office. So you're not looking at the person and triggering it. Some people might have continually, there seem to be in a giving out mode, or a sort of what I call a negative stream type mode continually. And sometimes you might put a stop to that and say, have an assertive phrase, say, well, do you know what? Today is not a day for negativity. There's enough of that going on in the world. I'm not going to engage in negative-based conversations. Neutral, fine. Uplifting, fine. But negative, no. And sort of having some stuff, so an assertiveness skill around that, and like a card that you can pull from your back pocket. And often the person who would go off because it's their normal habitual pattern, you would say, no, not for me today. I'm not engaged. The toxic, you know, I wouldn't maybe use the word toxic, but negative conversations, enough negativity. I always say that to people. Enough negativity going on in the world, not going to engage in those conversations. That's the sort of having some phrase. And then suddenly what actually happens is people then start orientating their conversations to a different narrative, because they know that if you're not going to engage in it, then so that can be a useful tool.
Well, one quite challenging strategy that I would suggest is, and it's applying one of the values in action actually, which if there's somebody that's kind of just annoying you a bit because, you know, as you said there, Sarah, that they have habits or whatever, but because one of the things is you get into that, that's what you notice all the time, isn't it? When you start tuning into that. But one thing that sometimes can shift that is do the odd kind thing for that person, because it shifts something in you as well. And that you just might start noticing some other more positive things as well. And the doing of that might also help to kind of build a relationship where you can actually say, look, you know, something is annoying you or whatever. But anyway, challenging one to do if you're a bit annoyed with somebody. But
well, if you're going to do that kind thing, right, do it on the exceptional day that they do something good, right? So then you're reinforcing that activity as opposed to reinforcing the negative activity.
Okay, so there you go. Okay, great.
Yes, that's really good. Like I really love the richness of this. We're definitely getting the answers here. Now I'm moving on because I have another one that I'd like to hear your views on. Why am I having strange and sometimes horrible dreams?
Oh yeah, that's it. This is very common actually. What's happened now is I've done a lot of these talks with different organizations and over time, and I always ask about this sleep thing. There's a lot of sleep disturbance has happened, particularly and vivid dreaming. And so again, real big thing. This is a normal response to this sort of threat. You see, the pandemic represents a threat to us. Something that represents a threat means that we have to go on alert, we have to be on guard. And when we're on guard, it's going to impact us on our sleep and our rest.
And I'm going to move on to another one now. I know I'm throwing them out fast and furious, but we're getting the benefit of the expertise, as I promised my audience at the beginning. Do you think that some groups in society feel the impact and pain of disconnection than, say, other groups? So, for example, they're saying that I believe people with disability and other marginal groups are extremely vulnerable.
Well, I know that some research has been done in terms of just experience of loneliness, which we've talked about here, that some of the groups of people that are experiencing most loneliness are older people and young people in the kind of 18 to 25 or that kind of 16 to 25 age group. So it's interesting that, you know, both ends of the life cycle, if you like, are experiencing something, you know, very much the same. So yeah, I think
particularly,
and I think
our services in mental health, our day hospital services in disabilities. You know, there was a long pause in services. Some have, and this, you know, so if you're a family member and you have an adult son or daughter that's maybe attending a day service in a disability service, and that service is closed, you know, that was respite for you. That's the reality. That, you know, the health service within the acute structure, acute services stood up, you know, but the community services had to support, like services went out into community swabbing, redeployment, into tracing, or, you know, and there was other services that stood down because they were re-engineering the work that they were doing. And that often impacted on day services, and it impacted on vulnerable people and families. There's no doubt about that.
I mean, I think the other group are people, residents in nursing homes. And not only them, but their families. I mean, how incredibly difficult that must be to not be able to visit, and particularly now. So, I mean, I think for everybody involved there, it must be incredibly difficult.
Just to say that, I want to maybe some of the work of the psychosocial groups. So each CHO area has a psychosocial group that are responding to, first of all, there's a couple of different things. So we've respond to the public through the community call system, responding to staff if staff feel overwhelmed. There's a staff, obviously the HSE have a support line as well, and there's the employee assistance program within the HSE. Then there's some work streams that are around particularly nursing homes. Is a particular area that was outreaching into support staff in the nursing homes. There's bereavement supports through the Irish Hospice Foundation. So there's a series of supports there for people as well.
And look at it, we could stay here for a much longer time. An hour is not near long enough for this webinar. As I did say, we definitely got great expertise here today. And I know, Eddie, I see it's coming up on my screen and flashing where people want to comment on loneliness and the mindset. So maybe as we're coming to the wrap up here, I'm going to ask Eddie and Anne here, maybe to put your thoughts together for us in some take-home tips. I'm a firm believer, take-home tips, that's what our audience really want. And maybe, Eddie, when you're doing that, is that you might just maybe give us some tips there about the loneliness and the mindsets that's into that. So take-home tips for us.
And I'll let you off there first. I'll switch your shoulders first.
Right, okay. The take home for me really is, I think, to do a bit of a stock take and just think about the relationships that you have in your life, and just to acknowledge the value and that they bring to your life. So to do that kind of stock take. Secondly, I would just say to do a reach out and have a think, you know, in your personal life or in your work life, is there somebody that you can reach out to? And the third thing, which really is the most important of all, is to really to mind yourself and to really practice and to do whatever it takes to really take care of yourself through this time.
Okay, now Eddie, take home tips, Eddie.
Take home tips and mindset. Okay, so I suppose I'm just going to give one. To me, it's about compassion, right? Because I'm a big fan of this. I'm big, not fan. I just think it's so important and so it's such a crucial area. It's like, how do you develop a framework of talking to yourself and talking to others that's done in a way that's compassionate? That is, it's not about perfection. It's about being good enough. How, you know, I'm doing the best I can. Given the experiences that are going on around me, I'm doing the best I can. And that's the challenge. I encourage you to think about that. And that takes a little bit of work. And it's the same with the loneliness and mindset, that the compassionate person to themselves who's experiencing loneliness is such it's a pain, a heartache. And speaking to that heartache in that compassionate way towards, and then I'd ask myself this question for all of us: what would I do if I was not afraid? What would I do if I was not afraid? And use that question to orientate yourself, to energize yourself, to motivate yourself, to do different goals in your life. What would you do if you were not afraid?
I just think they're wonderful tips. And I know, Eddie, I'm just going to put you on the spot a little bit here because I just see it coming up about loneliness. Any tip for me if I'm in that space of the loneliness or the mindset? Anything there to share with us?
So the loneliness and mindset is around the compassion. The person, individual speaks to themselves, because often there's a very negative narrative going on there. And so speaking themselves with self-compassion, what would they do if they weren't afraid? They would step out from just being in that isolated space and connect with somebody else. I just want to comment on the thing that's come through about the pressure on people in acute care. I think it's really, you know, it does worry me, actually. It worries me that the what I call it's the the continuous drip of those that are working in acute care. The requirement for rest and rejuvenation. And I just think that what may buffer within that is the team working as well while you're on, and then rest and rejuvenation when you're off. And we do know that a lot of people are probably including myself actually, in terms of food and alcohol and COVID stones and stuff like that. COVID stone, I should say, not stones. But it's sort of a self-soothing activity and stuff like that. So, but I would encourage you just to acknowledge that, but get the team working, the enhancement, start talking about it, start what can we do as a team around this, because it's conversations that need to be had in the workplace.
Look at Anne and Eddie, you're absolutely fantastic, and I'm thrilled, and I have to admire my backroom team for inviting you here today, because this actually has been, I have definitely felt it just so rewarding and so engaging, and I can imagine if we were in a room with all of that energy from the people that's into it. So you've given us and shared us great ideas here. This session is recorded, so it will actually go on our website, so you will have the benefit of seeing all of that information. We will be issuing you out a post-webinar pack for everybody that actually registered. So you will get the goodness there in relation to the calendar and all the tips and the guidance that we can give you. I thank you, Anne. And I also want to thank I'll call them the backroom team, because look at, I'm sitting here nice on my perch here in my bedroom, but look at the work that goes into this. So I'm going to call out and say, my team colleague there, Fergal Fox, you're always there to the fore and working so hard there with me. And also, as well as that, my own team colleague, Yvonne Gilson and Noreen Turley. You're absolutely fantastic, and that's great teamwork. I am going to say it's not over for them yet, because they are working so hard right now in relation to getting ready for what I tell you is going to be a wonderful event on the 16th of December. 4 p.m. Put it in your diary. Don't miss it for love or money. And we're going to have great participation from our own people and our own staff across the system. In my thanks, I'm also going to thank Leo. They're with us in our technical support. Thank you very much to Leo and the team. It's just fantastic to have all of that in place. I want to remind you about the survey. You will get a survey after this. Please fill out the survey, because we use the survey to actually plan our next session. And in January, February, we will be doing a joint session with our colleagues in HR. And I know that many of you are involved in the Pulse survey and information in coming back from that. So I'm working with my team colleague there, Vera Kelly. We will be doing a joint session and bringing all of that together. So as I conclude, I thank you sincerely. I have enjoyed it and I hope it has brought some joy. Double the joy, double the giving, and the sorrow is half. So we've great sayings and great reminders from this afternoon's. So now it's time to give away, like as Ryan Turber did to say on the Late Late Show. So look, there are now 5 Healthy Ireland gifts for the lucky winners of those of you who actually registered for it. So Leo, my backroom team, let's display the lucky winners from it. So we have winners here from Mary Kenny, Josephine Shikuhun, and now you're challenging me on that name, but delighted to have it, a Paula White, a Michelle Glenn, and a Neve Debris. We have your email address. We will be in contact with you and you will receive a very nice gift from us. So with that, I conclude. Thank you very much. Look forward to be back here again and take away all the good messages. Look, we're on a countdown to Christmas. Christmas will be different, but Christmas will be lovely. Different is good too. And we are writing history. So let's make it good and let's make the history good. Gurumila Mahagiv, have a good day and may the road rise before you. Thank you very much.